Hello, welcome back to Meditalk. And taking us from the last discussion we had in the last episode of Meditalk, we are continuing our panel discussion about COVID vaccine, particularly hesitancy, vaccine hesitancy. Now, this is a very relevant point because University of Melbourne survey has shown that between 20 to 25% of the population are reluctant to take vaccine. Now, in this context, it is worth knowing how horrendous COVID is, especially when a patient lands in ICU. Now, Dr. Satyajit is here. He's an ICU physician, and we saw him in the last episode. Dr. Satyajit, can you share your experience about, the horrifying scenes sometimes we have seen on the mainstream media, people struggling to breathe, or they battle for air. So can you just enlighten us about that part of COVID?
COVID virus, just like a large number of respiratory viruses which affect our body, causes predominantly a respiratory problem, but also it affects other systems of the body, other organs in the body, like heart and kidney and the whole body in short. In the early or mild stages, patients present predominantly with lack of oxygen in the body and changes in the lung, which makes them breathless, so they struggle to breathe. So that is what you see in patients presenting to hospital or being unwell in the community. Once it affects lung to a larger or much severe level, they cannot sustain that breathing by themselves. So they need very high amount of oxygen, and we sometimes use certain mask ventilation to support their breathing, mask breathing machine. Or if they are still unwell, we have to sedate them, put them on an induced coma, and put them on breathing machine. All respiratory viruses or any virus attacking the body can also cause severe changes in the body's immunity and biochemistry. That changes the blood, changes the heart and circulation, body goes into shock, it shuts down blood flow to various parts of the body goes into kidney failure, the brain gets affected, the liver gets affected, every part of the body gets affected. It also causes severe damage to the muscle and entire tissues of the body. That's why during in milder cases, the body's immunity overcomes the virus, and some of this severe damage is prevented. In some cases, early stages, body is able to recover, but and it also depends on how the system is. As Naushad was saying, in UK last year, when the health system was overwhelmed and there was not enough high level of care offered, they had nearly 35 to 40% of the patients who came to intensive care died.
Yeah, that's when we have seen this sort of horrifying pictures, like when people did not have enough resources, like no beds for admission. That is something that we need to convey to the public, how bad it can be, and that is what vaccine is preventing.
Absolutely. In UK last year, they were basically turning away or not accepting anyone above the age of 65 or 70 into the hospital at all with COVID at one stage. And a large number of Europe, I'm talking about well-developed countries. And Florida at the moment in US is somewhat reaching to that point. As you know, Florida is a largely unvaccinated state. And it is now reaching to a state of running out of oxygen in a developed country with all the vaccines in the world available, large piles of stock available. Whereas what happened in India a few months ago was where we did not have enough vaccine and we did not have much health infrastructure either. So it is a no-brainer that vaccine needs to be done. And also the effects are horrific.
Yeah.
Normally, further to answer Dr. Elias' question, normally in India, 1 in 6 patients who come to intensive care will die, and the rest, large proportion of the people who survive do well, but still a percentage of them end up on hospital stay, deconditioning, both psychological and physical trauma, as well as ongoing health effects, which last months or years or lifelong in some cases.
So, Dr. Manoj, the discussions are, converging into a very clear direction that vaccines are offering a huge advantage. What can we do to facilitate vaccination within the public? How can we address their concerns or reduce their anxiety about vaccination?
Thank you, Dr. Alby. Yeah, certainly it's a most important question, isn't it? In terms of how we have enough evidence with the professionals who was working in this area that vaccines are helpful to deal with this pandemic, and it can make a change, it can make a difference in our lives. So why we are not having the vaccine? So obviously, I think a lot of the people who are not having the vaccine, or they're hesitant to have the vaccine, it's not that they don't want to have the vaccine. I think they're probably in a process of decision making, rather than not completely deciding not to have the vaccine. There's only a very small percentage, belong to that category. As Dr. Naushad previously mentioned, we will not be able to have 100% vaccination. But I think our aim should be to reach this point where a reasonable level of vaccination, where herd immunity is developing. So when it comes to this group of, people who are still hesitant, I think we need to acknowledge their situation. I think they are confused. Obviously, they are emotionally affected, with that situation, with the between the door and the deep sea situation. So we need to understand and acknowledge that, and provide information, or those individuals who haven't had the vaccine yet. I think they should, look at their specific situation rather than taking the generalized message, what they see in different informations they are having access to. They should see their general practitioner to look at their specific health situation, looking at the, how much risk they have,
So it is like, rather than confronting them, understand their situation and their concerns, and sort of engaging them, maybe.
Absolutely.
Yeah.
It's not simplistic. It's a complex situation for those individuals. We need to understand that. The decision this is a major decision. It's a survival situation. So we need to understand that they are taking a major decision, for them. So we need to acknowledge that. We need to appreciate what they're going through and being sensitive. This is a complex issue. It's not a simplistic issue. When we sit on this side of the table, right? We may feel it's a simplistic issue. Our access to information, our understanding about our thinking process is different. And when it comes to the person sitting in front of us, community who haven't had the vaccine, what they are going through, and asking the right questions. The doctors could ask the right questions, what they're worried about, what they're scared of. How can we educate? How can the government educate? How can we provide easy to access information about not just vaccine is safe, but also providing this information about if they have the vaccine and what will be the risk, and if they have the COVID infection, what will be the risk, and comparing those two. We're not aiming at 100% lack of risk. We cannot absolutely eliminate the risk, which is same for any treatment in medical science, which is same for any vaccine in medical science. And we have done it always. And what is it different this time? Having those dialogue, having that discussion. If you haven't still had the vaccine, please see your general practitioner. Looking at your specific health situation. Are you at risk, and how much is the risk, and what is the information available? And then having that information and taking an informed decision about your health. And that makes a big difference. Obviously, a lot of us are going through, a lot of people are going through significant mental health issues, and not just in relation to the vaccine situation, but also the overall impact of the COVID, the economic situation, the relationship situation, domestic violence, and a number of issues related to not being able to travel, not being able to be with their friends or family. So they are going through a lot of issues. So if your mental health is significantly affected because of this, obviously, if you are experiencing significant anxiety symptoms, if you are experiencing sleep disturbances, or if you are experiencing any mental health issues, self-harm, suicidal sort of thoughts or anything like that, you do need to seek help. You do need to see your GP. You do need to have professional help. There are a number of ways you can access help. So it's very understandable what you're going through. It's not easy. It's hard.
Yeah.
And join hands together with the government, with the health professionals.
Exactly.
As a team, we need to fight this. So I think that's what we contribute to the community. To what extent we can contribute.
Yeah, so Dr. Manoj, again, coming to the vaccine hesitancy, so it's more like a partnership approach, trying to understand from their perspectives. As you said, it's a big decision. So for them, as you very poignantly said, when we sit on this side of the table, it's a different perspective. So being considerate, being empathic of what people are going through is, I think, indeed a helpful strategy.
Absolutely.
Thank you very much.
Absolutely.
Thank you very much. Yeah. Now we have got a question from Usha Krishnan. Usha, I think she's here. Yeah. So, what question do you have?
Thank you for the opportunity. So, my question is it safe to take Astrazeneca for those people who take tranexamic acid, which is given to people with bleeding problems? So this will stop the heavy bleeding by inducing blood clots. So the reason I'm asking this is, will Astrazeneca double the chances of getting the blood clot?
Unfortunately, our hematologist, Dr. Anish, has just left, but we will try to get him back.
I'm happy to answer the question because as an ICU physician, I do have patients coming with all specialties under my care, and all of the sick patients in the hospital many times get discussed with us. I had long discussions with our hematologist on this topic recently. And we do see a lot of patients with tranexamic acid who generally they actually end up in the hospitalized patients who need tranexamic acid are usually patients who are in intensive care. So on that context, now as I gather you heard Dr. Anish's comments earlier, the clotting risk associated with AstraZeneca vaccine is not its routine side effects. So there are side effects which certain medicines can have based on their mechanism of action. They invariably cause certain side effects in a proportion of patients. Then there are side effects which are entirely unpredictable, which we call idiosyncratic reactions. So they are entirely unpredictable reactions. And this particular clotting associated with AstraZeneca vaccine comes under that category. Happens through a certain immune mechanism. We know the immune mechanism, how it happens. And to give you a very similar analogy, heparin is a drug we in fact give to almost all hospitalized patients. Every hospitalized patient for any length of time, we give them heparin to prevent them developing clots in their particularly leg veins. due to the lack of mobility. Because when in hospital, we are in the bed or sitting down most of the time, just as you're in a long haul flight. And heparin, so we are actually giving heparin, it's an anticoagulant or anti-clotting agent to reduce clotting disorder. But heparin, by the same mechanism, exactly the same mechanism, I won't go into the details what Anish already said, causes clotting a very small, extremely small number of patients, just as the COVID vaccine does, and they are the same immune mechanism. So those reactions are unpredictable and they are extremely rare interaction of the immune system to this sort of medications. So there is no way of predicting who will get it, but they are extremely rare. So to give you an example of Western health, we cover a geographic area of around 1 million population. We see heparin-induced thrombocytopenia confirmed in once a year. And that's perhaps what we are seeing with COVID vaccine. So they are extremely rare. Yeah. And another point to give you more peace of mind is that the clots you get from other reasons, a lot of patients, a lot of people in the community, you and I can get clot from other reasons, including flying from here to UK, perhaps, or due to cancer or various other things. That has no relation to the clotting due to this medications or COVID vaccine or Astrazeneca vaccine.
Yeah.
Similarly, your medication, your tranexamic acid or other medications, whether they cause clotting, they reduce clotting or they promote clotting, they have a predictable relationship with the Astrazeneca vaccine.
Thank you, Dr. Satyajit, for addressing that question. But I've got a question regarding the Pfizer vaccine. There were concerns about myocarditis from Pfizer vaccine. But myocarditis, if it is so severe, I mean, that will again end up in ICU. Have you seen patients with myocarditis so severe that you see them in ICU?
We do see quite a lot of myocarditis patients coming to ICU. When I say quite a lot, a reasonable number every year. And that is due to a lot, particularly with viruses or due to other factors. We haven't seen any Pfizer vaccine related myocarditis. As you know, the number being vaccinated with Pfizer in Australia is smaller still compared to the rest of the world, where we had nearly 200 or 300 million people vaccinated with each of these vaccines. So we haven't seen specifically from Pfizer. Myocarditis can, like any illness or any severe illness, can vary in severity from relatively mild to moderate disease to life-threatening illness. Now, again, my point is, these are extremely rare side effects. And we are talking cheese and chalk in terms of the incidence of you as a community member getting it at any point in time. So compared to the chance of you getting COVID and being significantly unwell and really having a severe problem such as myocarditis or something of that severe nature, is way higher with COVID than with vaccine.
So that is quite reassuring. So the myocarditis from Pfizer vaccine is not as severe as you see from other illnesses. So we don't need to be worried about Pfizer vaccine's myocarditis at this stage.
I wouldn't say it is not as severe. I would say in terms of incidence, it's very rare. It's very
rare. Yeah. Now, Dr. Anoop, I think we are coming to the final part of this panel discussion. People in the public, I mean, we had questions from our esteemed audience about this. They hear about like Moderna vaccine is coming, and they also are very curious about future vaccines. So naturally, there is a question, why can't we wait for new vaccines to arrive? I mean, rather than going for vaccination at this stage, especially when we hear these concerns. So what's your view on that?
Like I said earlier, the best vaccine you can get is the vaccine you can get right now. Now, what you need to remember is that, again, something which I said earlier is that we are a virgin population as far as immunity to COVID is concerned. We have not had many cases here at all compared to the rest of the world. So if this outbreak is going to get out of hand, it is going to rip through this population. Now, waiting for a Moderna vaccine, well, it might be, at least, maybe it is a better vaccine, maybe it is slightly better, maybe an additional 5% better protection, maybe decrease in the side effects by maybe an additional 10% compared to other vaccines. But what we can say with a much greater degree of certainty is that if you do get COVID, all these numbers do not matter at all. So, like I said, the best vaccine you can get is the one you can get now.
Okay, so
when it comes to preventing serious disease, all vaccines have really good efficacy.
thank you, Dr. Anoop.
Yes, if I may add a short comment. In terms of the one point, many a times we as doctors perhaps don't explain to the patients and their families is that every time we talk about a treatment to a patient or the family, we are mentally doing an arithmetic on the risk versus benefit of this intervention. Whether that's a medication, a simple medication like aspirin, which has been around for 200-300 years. Aspirin is used very widely for things ranging from headache to preventing blood clotting to keeping your cardiac stent patent to reducing your stroke chance. It's extremely widely used. Aspirin can cause bleeding from your stomach, and can cause other reactions. If you were to actually see any drugs description in MIMS, which is a very widely used medical pharmaceutical preparation guideline, a long list of adverse events and side effects for every single drug. And this not only applies to drugs, but it also applies to any procedure. Every time you go to your gynecologist or your surgeon, and we always mentally do this mathematics. Is this for this particular patient? Does the risk or the benefit? How do they stack up? That is, the benefit overall outweigh the risk for this particular patient. Okay, and in this particular situation, in an evolving pandemic, which is now catching up in Australia with a largely unvaccinated population, our risk can change any moment in a matter of few days, as we found out in New South Wales and in Victoria currently. Whereas for us to be able to get the vaccine, 2 doses, get the immunity, it will take time. So our benefit, we won't get the benefit of vaccine in such a short time. So best vaccine at the moment is already in your arm.
Yeah, that makes a lot of sense, Dr. Satyajit. Now, Asha or Usha, Preeti, do you have any more questions, please?
The doctor.
Yes, I had a question, if that's okay.
Yes, go ahead.
Okay, like the other doctor previously said, I totally agree. It's the lack of trust in the system that non-medical people have. Either there's excessive information or there is lack of information. So even with the teenagers, I'll come back to the same subject. The original what statements were given out were that they did not require a vaccination. And then comes Delta variant, everything changed and they said children are at risk, they need vaccination. So this is causing a lot of confusion among parents, at least in my case.
So who would like to answer that?
I guess I'm happy to address one part of that question, and other panelists might have other comments. So initially, when we try any drug, any new drug, development, they had to undergo a very rigorous process of clinical trials, ranging from cells culture to small animals to larger animals to human volunteers and then patients. And the vaccines, I'm referring to largely the vaccines which has come out from the West. They have undergone the process extremely rigorously. And whenever we do that, we initially trial them in adult population, not children, and we exclude people who are vulnerable, like pregnant and other things. So that's why the initial data was available for largely adult population who are not into any of the vulnerable categories. So that's why it was prescribed for adults initially. So subsequently, there were Pfizer and other companies were doing trials in younger population and even children now. And so that's why the age bar has changed. And then it also has, there is certainly a possibility, and as others can correct me, with Delta variant, we have at least seen that the ICU patients in New South Wales, for example, the ICU patients, median age was 65 last year for us, whereas now it's 55. And that's median age. So there is a shift into younger population with the new variants. And the viruses evolve continuously all the time. The influenza virus, which caused pandemic in 1915, has been evolving every year. The vaccines, we healthcare workers take flu vaccine every year, and our vaccine is basically developed based on the genetic shift and drifts of these vaccines and predicting what strains are likely to happen for next year. So there is always evolution. So the vaccines are, it is an ever evolving science. So that is what perhaps we have failed to tell the public, that there is an evolution in science, but we, even though there are uncertainties, we are actually nearly 99.999% certain.
Yeah.
Yeah, I'll just add a brief comment on that as well. Thank you, Satyajit. Satyajit has explained it very beautifully. It's not never set on the stone. What it changes, it evolves. So the information available to the healthcare providers also updated, as we go. So the information changes. So obviously, but one thing I wanted to talk about is the trust and the information what we get. So there is a lot of misinformation, a lot of fake news and conspiracy theories available in the social media, rampantly available. So unfortunately, that's happening. So we got to be very careful where we get the information. So as WHO rightly said, the infodemic, we need to manage that as well, along with all of these. So we just have to access the information from the trustworthy sources, which will be your doctor or the professionals working in this area. I think that's the only way we can, but the information what is provided could change as well. I think we need to be able to sit with that uncertainty to some degree. We cannot have completely all the information available at this point. So unfortunately, that's we all need to accept that. It's the same for people providing health as well as receiving health. It's just a point.
Thank you, Manoj. Asha, Menon, do you have any question?
Yes, doctor. My question was in regards to an efficiency of a vaccine if a second dose was not available within the recommended time frame. So what do we do in such a state? Because right now all the bookings are going on for the first dose of vaccine and we can't find a date still available for a second dose within the time frame.
Yeah, very, very realistic problem, isn't it? I will leave that question with Anup. Can you?
No, let us. Okay. So you want to know if the second dose gets delayed by a couple of weeks, does it have an impact? Now, these durations are not exactly set in stone. You do have a bit of a plus and minus situation there. For example, the recommendation for the Astrazeneca is that the 2 doses should be about at least 12 weeks apart. A little more than that does not cause a significant decrease in the immune response. Now, when it comes to AstraZeneca, yes, it is a problem if you are going to cut it short below 12 weeks, but above that, it is not going to significantly impact that. Now, regarding Pfizer, they say that the best time period is 3 weeks, but again, a week or maybe 10 days extra is not really going to significantly impact that.
So there is no need to drop the vaccination halfway, even though there has been a slight delay. So I think the message is go and get the vaccine, even though there is a little bit of delay. So yeah, any other questions before we wind up? Yes, please.
Hi, thank you, doctor. My question is regarding mixing and matching the vaccine. What about taking a different booster vaccine?
Now, if I may answer that, well, I should start off by saying that the information is still coming in, and this is subject to change. But there have been a few studies which did try mixing and matching. They found that it is actually giving a slightly better immune response. So that's not going to hurt you, but yeah, you might end up gaining with that.
So does that answer your question, Usha?
Yes. What about the booster vaccine? Because I know that we have a lot of AstraZeneca sitting there. So in future, if we are running out of Pfizer and we are supposed to take AstraZeneca, is it okay if the Pfizer people take the AstraZeneca?
Let's take that. Okay, good question. I'll have to answer that. The information, the impact. We don't have enough information yet. This disease is still new, and long-term studies are going to be long-term studies, and we haven't reached that stage yet. All I can tell you is that what I replied for your previous question: mixing and matching vaccines. Yeah, there have been very few studies, a couple of studies maybe. And some of them showed that yeah, the immune response is improving. Now, your question as to whether you can switch it off and switch off into a booster vaccine entirely. I mean, at this stage, we are not even decided whether a booster vaccine is going to be given or anything. So it is simply too early to say.
Yes, I mean, we have been dealing with a natural virus and, a disease of which many aspects are still unknown. So, but I'm pretty sure that more information will come in future, considering that vaccine was developed for an infectious disease in an unprecedentedly fast period, very rapid development of the vaccine that we never witnessed in history. Now, before the last question is to Dr. Manoj again. I mean, our vaccination rate is going up in almost every society. But as a other side of that, is it possible that people, after receiving the vaccine, become too confident so that they don't comply with the public health rules, thinking that, oh, I had the vaccine, so let me go and do whatever I like. How do you see that sort of psychological, that sort of mental state after having vaccine?
I think it's, and there are two sides to it. Certainly, you feel a false, you feel a sense of security. That's what we've been educating, isn't it? Vaccine is helpful. So obviously we can't, to some degree, people are feeling more confident. But the other side is, they can still get infection. If they have the vaccine, not for Delta, they got the vaccine for the previous strain. So they can obviously get infection and they can spread to, the virus to more vulnerable people. this is where it comes, how you see as an individual in the society, how you fit in. Is it you more important or the society important? You got to have those thought process within you. What is my contribution? In this pandemic. So we all have to be responsible, obviously. Even if we had the vaccination, we have to follow the rules. The rules are there for a reason. Until we are allowed to. So I think this is definitely a challenge. Until a time where the population, a significant percentage of the population, 70% or whatever percentage we decide on, is vaccinated, and we expect more herd immunity, and we're more free to move around. We should all stick to the rules. So that's,
Thank you. So, as Anup said from the very beginning, it is very clear that even with vaccination, you may get infection, and although the transmission risk is reduced, you may still pass this virus on to others. Dr. Anup, you want to add something?
Yes. What I wanted to add is there was a recent study which actually looked at viral loads in people who are infected following vaccination, and viral loads in people who have not been vaccinated and have gotten infected. Now, what they found out was quite interesting, really. Now, the period of transmissibility in a vaccinated individual who gets infected is cut down, right? But during the peak infective period, they are just as infectious as an unvaccinated person.
Yep. That's very important, yeah.
So like Dr. Manoj said, we really owe it to the society to keep everyone else safe as well. So just because you're vaccinated doesn't mean that you can walk around without a mask or go around flouting all the lockdown rules.
So please don't take it wrong. Even with vaccination, you may get infected, but what vaccine is doing is to prevent severe illness. So it is helping us to avoid serious complications and death. That's very important. I mean, that difference is very crucial for us to behave. Now, Dr. Satyajit, very quickly, you want to say something?
I guess just to add to the recent comments, it is unprecedented that we actually made a vaccine for such a pandemic in a relatively short time. But that is due to the accumulated scientific knowledge and wealth over several centuries. We are able to do that. We lost nearly 50 million or 50 to 100 million people in the pandemic exactly 100 years ago. So that's a real scientific achievement. And it is be a real shame if we were not able to utilize it for our benefit.
Yeah. So I think we had a lot of discussions, and we live in a world where social media are propagating a lot of information and news. And in stressful time, as Dr. Manoj rightly said, we are vulnerable, and when we look for answers, especially in a complicated time, we are attracted to easy answers, and these are the answers the fake news are providing to us. So it's very important to keep in mind. I hope this helps us to take the right decision. I thank you everyone for contributing to this session. Your information is highly valued, and thank you for all the members from the public, and see you again. Thank you.
Thank you, Dr. Alby and M4 TV, for the opportunity. Thank you.